Hey everybody, my name is Dr. Daniel Choi. I'm a board certified periodontist since 2011. Here in 2023, I have placed over 10,000 implants. But the goal of this video is to how do we avoid from looking like this or having an outcome like this. So in this video, I talk about bone grafting and what significant impact it can have on your dental implants. So this video is pretty exciting for me because, I do this a lot. I've done bone grafting since residency, so over 15 years now here in 2023. My whole goal of this video is to get you guys to understand what impact bone grafting may have with your dental implants and how it can affect the longevity of your implants and even in worse, the aesthetics like I just showed you, okay? And also, what is the cost associated with this topic? Now, I've actually made another video, a topic very similar about bone grafting. It's just not as organized, but I would highly recommend that you check out those videos, and I'll link them above here and down below in the information. But I highly recommend, it can help give you some baseline information. But this video is going to be specifically geared towards dental implants and everything you need to know about bone grafting. Now, I know you might be looking at the time below and be like, oh my God, this video looks insanely long. Do I really want to listen to it? But if you're serious about your dental implants like I am about everything in my life, I love to research the heck out of everything. I made this video for you. I've literally spent over a month on this one video alone. And also, I've made other videos in this implant series that talk about anything and everything that you want to know about dental implants. So I would also highly recommend you check out those videos, and I will link them in the videos below, okay, in the information below. So hopefully you guys can really watch and pay attention to this series. I've tried to make it digestible. I really tried to, kind of like put everything in layman's terms so it's easily understandable. And I really hope that you guys can, again, take this information and move forward and have the best outcome with your dental implants. So if you guys have any questions, please feel free to leave them below. Also, feel free to follow us on Facebook and Instagram at North Texas Dental Surgery. I wish you the best of luck on your implant journey, and also stay tuned to our future videos. Thank you. All right, dental implants, what you need to know, bone grafting. Let's get it. All right, so the big question is, how do you save this and how do you avoid this? So why watch this video? If you are informed, you will be able to ask the right questions to make sure you get the right treatment and save money. I've seen many common themes in the past. Anybody would obviously try to save money, but I've seen some patients go the cheap route and get botched. As a result, sometimes they have horrible aesthetic results, like you just saw, can't chew properly, have implants fail later on, maybe have damaged nerve, etc. And in the end, they spend a lot more money to get it fixed. So dental implant treatment doesn't have to be expensive. The goal of my videos are to teach you insider information so you can come as reasonably close as possible to diagnosing like a board certified periodontist. What credibility do I have? I am a board certified periodontist since 2011. I've placed over 10,000 implants in my career. I placed dental implants for single teeth, implant bridges, denture implants, all on 4 teeth in a day. Also, I do normal bone grafting for socket preservations after an extraction, more significant bone grafting with guided bone regeneration. And those are types of bone grafting that I'll talk about later on in this video, sinus lifting, etc. And I also perform gum surgeries for gum grafting and also gum disease treatment because your gum health has a significant impact on your dental implant health over the long haul. So I've made a few other previous videos. I highly recommend you watch those. I will link them in the information below, just so that you can understand all the concepts that we're talking about. But just a recap, in video 1, we mentioned that you want to place as long and wide of an implant. How much bone you have determines how long and wide of an implant you can have. In video 2, we mentioned how we need to take the maxillary sinuses and inferior alveolar nerve into account when deciding how to size the best implant to the bone. And we also discussed how the CBCT 3D scan helps to perfectly diagnose the bone dimensions when deciding what implant to place. And most importantly, we also discussed how you want at least 2 millimeters of bone all around the implant to ensure the vitality of the bone. So too many times I've seen patients who come in for an implant who say, hey, I already had a bone graft done and I just need the implant. And I take a look in the mouth and the CT scan and say, well, you may have paid for a bone graft or had one done, but it wasn't done properly or had been too long. And since you've had the bone graft done and you need more bone. Sometimes I also see cases where they already had the implant placed and just want to get it restored with the crown, but there's definitely not enough bone surrounding the implant. So this video will help you figure out what to look out for to make sure you get diagnosed properly and have the procedure properly done. So for bone grafting, Remember that the CBCT 3D scan will tell us your bone dimensions. Let's say you don't have ideal bone dimensions. Well, we can't change your bone density, how hard your bone is, but we can add more bone horizontally or vertically or both. And so bone grafting is a procedure where we just add more bone to your jaw. So there's different types of bone grafting, but we'll go over that later. But when adding bone width, other than for sinus lifts, bone grafting is almost 100% of the time added to the outer edge of your jaw. The reason is that after you lose a tooth or you have disease, bone is always lost from the outer edge of your jawbone because that's where your bone is the thinnest. This is the bone that needs to be replaced so that the implant can be placed in the correct spot. So what we're looking at, I just downloaded this picture from the internet, but here's some teeth. Obviously, this is where the patient lost the teeth, and without the teeth there, I mentioned in the previous videos, again linked below, but without the teeth there, you don't have the forces that are being exerted onto your bone, and because bone is living tissue just like muscles, that's why the bone starts thinning out. Well, the bone starts always thinning out on this outer edge next to the cheeks. Okay, well that's where the bone's being lost, and that's where we need to add to the bone. Okay, so there's many different types of bone grafting. Of course, they have different costs associated with it, and obviously invasiveness, recovery times, etc. And I'll go over that in the future. So what if we don't do a bone graft if needed? Then we won't be able to place as long and wide of an implant as we need. Okay, so especially width-wise, right? So if we don't get that, we've lost that bone on the outer edge, how are we going to be able to place as wide of an implant as possible? Because in a previous video, I also mentioned that we need to make sure that we have at least 2 millimeters of bone thickness. If we place this implant here, then we need another 2 millimeters of bone out here. So we need to make sure that we have enough bone there, right? So what dentists will do is they'll compromise by placing the implant in an area of more bone, and this will result in the implant being out of position and affect how you're chewing. Okay, so what they will do is, because they don't want a bone graft, or because patient says they can't afford it, so they say, all right, let's try to do this without the bone grafting. Well, you don't want to do that because you're not going to have an ideal result. So what they'll do is, in order to make sure that they place that implant where there's more bone, they're going to place that implant not where it needs to be out here, but they'll place it further down here. And that implant is then going to be out of position, and it's going to start having a whole host of other issues, because then when you're biting down where the tooth is over here and the force is being delivered to a different area, you're going to start having all these other issues. Okay, so let's see here. So continuing the same concept, so what if we don't do a bone graft, right? If we place the implant where it's supposed to be without the 2 millimeters of bone on the outer edge, then we can experience further bone loss around the implants, affecting the health and the aesthetics of the implant. And in worst case scenarios, you lose the implant. So again, what this person did was they didn't have enough bone in the area. The bone was lost on the outer edge. They didn't have enough bone, and then they placed the implant. And this is a positional thing too that they probably screwed up also. But because there was not enough thickness of bone, then the bone was lost, and then also the gum was lost. And I described that in a previous video. So again, it's linked below. Highly recommend you watch it. So going back to this animation, what they then did was they placed the implants where they ideally wanted them, but because there wasn't enough thickness of bone, the bone started dying off, and then the gum started dying off. And that is exactly what you see right here. Okay, so hopefully you guys are following me on this. On to the next one. Bone grafting sounds expensive, right? That's, I've been, this is my 12th year of practice, plus 3 years of residency. I've been seeing patients for 15 years with dental implants, right? Very common question. Whoa, that's going to add more expense. First question is going to be, wow, are you trying to take me here and take me on a ride? What's going on here? Do I really need this? Is my, dentist being truthful? Well, here's some basic guidelines. Again, this is not to be 100% all-encompassing. This is a general guidelines, right? So if you're talking about a front tooth, unless you want it looking terrible, then yes, you 100% of the time do need a bone graft, okay? Front dental implants can look fine now, but develop issues in the future. So many times it has to do with the bone and gums. Your bone supports the gums. If you don't have the proper bone around your implant, the gums won't look right, and therefore your tooth crown will look terrible. So just again, two little small examples of patient who didn't have enough bone and gum, and therefore it resulted in a poorly aesthetic result. As with many other things in life, prevention is cheaper and more predictable. So proper planning, execution, and prevention by having enough bone and having the proper implant sizing and placing the implant where it's supposed to be will help give us this predictability, okay? The problem is you have to have enough bone around the implant, right? So you have to have the bone graft done before the implant placement or at the same time as the implant placement. You cannot do this later on when you realize that you don't have enough bone. After the implant's already been placed months later, you say, oh, I don't have enough bone. You can't just go in there and add more on, okay? So you cannot place the implant, realize later on down the road you don't have enough bone, and then decide to try to add more bone at that time. So therefore, it is critical you do the bone grafting correctly at the beginning, okay? So whether that means before you place the implant, you add the bone, or again, you place the bone at the time of the implant placement, it is critical that you properly plan it. Again, I'm going to reiterate, very important point, proper planning, execution, and prevention by having enough bone, proper implant sizing, and accurate implant placement will give us predictability. It's a heck of a lot easier to get predictability with your dental implants versus trying to fix things later on, okay? That's what any dental implant specialist will tell you, okay? So this information, by the way, again, reiterated, it's in the previous videos. Please check the link below. So also the health of your implant is based on having enough bone surrounding your implant. You want to have at least 2 millimeters of bone on the buccal side and 2 millimeters on the palatal or lingual side. So if you look at me in profile, you want to have 2 millimeters of bone on the outer edge and 2 millimeters of bone on the inner edge. So we talk about it in this is an x-ray from the side in profile, and you can see the outer edge where the outer lip is, inner edge where the roof of the mouth is, nice amount of bone around that implant. So in fact, if we're talking about a front tooth, do not mess around, and you must make sure you see somebody who's very well experienced at bone grafting and implant placement to ensure you get the best result. Guys, I placed tons and tons of implants. I've done tons of anterior teeth. I'd be lying to you if I told you that, for patients that have high smile lines where they have a Julia Roberts type of smile, that when they smile that you can see their gums, that it's not a risky situation. Even though we place thousands of implants, you still want to treat every patient that has one of these cases as a very unique case. You want to be very cautious. You want to make sure that they have plenty of bone. You want to be very cautious with your implant placement, and you want to be very extensive with your planning. I'm going to create a video topic in the future, so just be on the lookout for it also, talking about just anterior dental implant placement alone. It is a complex topic, and obviously, your smile and your confidence and everything that comes associated with it is based off of how beautiful your teeth are, so we can't mess around with it. So critical factors for determining need for bone grafting. Well, are you missing your tooth? And if so, for how long? The longer you've been missing it, or if you genetically had thin bone, then you will need a bone graft. Is it a front tooth? As I said before, you should 100% time get a bone graft, okay? In regards to a back tooth, do you presently have the tooth? How easy will it be to extract? The more difficult it is to extract, the more likely the more damage will occur to the bone in the area of the tooth, therefore requiring bone grafting. So yes, what I'm saying is, how long have you been missing the tooth, right? If it's been a long time, you're gonna see some bone atrophy in the area, so therefore you more likely have to add bone. And also, if the tooth was extracted, if it was a traumatic extraction or you've had a root canal on it, then I'm gonna talk in the next few slides kind of what that means. And so it's a case-by-case basis. And therefore your surgeon should explain with your case in regards to likelihood of needing a bone graft. Sometimes in certain instances, there will be extensive bone loss from a very large gum disease infection, large root canal infection, trauma, meaning a car accident or punch to the face or falling on the sidewalk, or a tooth that is extremely difficult to remove that will destroy a lot of bone in the area. In these cases, extensive bone grafting called guided bone regeneration, often called GBR, will be required. This is more invasive and more costly. So let me back up a little bit and talk about thin bone versus thick bone, okay? So patients have different body types. They also have different bone and gum types. In dentistry, we refer to this as their biotype. Some people have thick biotypes, while some people have thin biotypes. Just like some people are tall, short, skinny, wide, everybody, different genetics determine these things, okay? So thick biotype is when a patient has thick bone and thick gums. And it's better to have a thicker biotype when it comes to dental implants because it's more predictable. We always love more bone, more gums, okay? Excuse me, when coming to dental implants. Thin biotypes mean thin bone, thin gums. Patients like this tend to have more bone loss and recession of gums around dental implants unless they are properly bone and gum grafted, okay? So made this video, I'll go over this real quick. All right, so I want to give you an example of a patient with a thick biotype, meaning thick bone and gums. And this is a patient of ours, but this is what we're looking at is the upper tooth, the lower tooth, this is the front. And you could see this is the nose, this is the upper lip, this is the lower lip, and this is the stick that we have you bite on for this 3D scan. This is his tongue, roof of the mouth, right? So what we're doing is we're looking at him in profile. And so you could see that he's got a lot of bone right here, right? This is his root. It's kind of a little bit hard to see. There we go. Okay, so that's his root. And you can see that he's got plenty of bone out there. And then when you go lower, you could see also the amount of bone that he has down here. So here we go. We made a measurement. We got 8 millimeters of bone. And let's look at another patient who has a thin biotype. All right, so this is a patient that we're actually doing a guided bone regeneration. I'll discuss that later, but we're doing one on her tomorrow for her lower left teeth. But on her upper teeth, you could see that her bone is tremendously thin. We have very little bone on this outer edge and on this inside edge. So if she wanted to get implants, she would need bone grafting. Even worse, let's look at her lower. She hardly has any bone around this edge. Like, look at how thin that bone is, right? So this is a patient, an extreme example of a patient that has a very thin biotype. So if she wanted to get dental implants, she would need extensive bone grafting. So hopefully that can illustrate a thick versus thin biotype. All right, so I mentioned previous few slides before about regards to difficulty with extracting teeth and how much damage that can cause to the bone. So here we'll talk about it. The problem is that the harder that the extraction, the more likely more jawbone needs to be removed. The bone that is usually removed is bone on the sides of a tooth and bone on the buccal, which is the outer edge, or the buccal, the cheek side or the facial. Those are technical terms within dentistry. So, but that's very important bone. If you've been watching my videos, you'll know that that outer edge of bone is super important for determining the predictability and the future of the dental implant. So examples of teeth that are harder to remove are teeth that have very large cavities because, you know, so much of the tooth is rotted away that the tooth is crumbling. Also, you got root canal teeth, which have just been hollowed out. And you also have very long roots, which are like, you know, imagine like I'm taking a 1-inch screw out of the concrete, or am I taking a 5-inch screw out of the concrete? Obviously, so the longer the root, the more problem. And patients that have very dense bone, am I taking something out of concrete or am I taking something out of drywall, right? So large cavities, a part of the tooth above the gums will snap off, leaving just the roots buried in the bone, and the roots won't be able to be removed without drilling some bone away. Okay, root canal teeth. The teeth are hollowed out. So when we do root canals, we hollow out the roots, take out the blood vessel and nerves, right? So the teeth are hollowed out, making them much weaker and more likely to break during the extraction process. This leaves root fragments that are difficult to remove, and the only way we can remove it is by removing more bone, okay? And so I gave this quick example. Imagine this old rusty pole, right? That's basically been, let's say it's not a solid pole down below the concrete. Let's say it's been hollowed out. So like I'm trying to move it, and boom, this snaps off at the level of the concrete, right? So the only way I'm going to be able to get it out is by drilling some of the concrete around it, right? So now you're going to do damage to the concrete, and then someone may say, well, are we going to be okay with this? I was like, well, no, we need to basically fill in the concrete and restore what the concrete looked like before, right? And also we talk about very long roots. The longer the tooth roots and the more irregularly that they're shaped, I mean, like, look at this, right? I mean, this is a drastic example I downloaded from the internet. The more difficult it is to remove the roots without having to remove a lot of bone also, right? So I'm gonna go in there, have to take these roots out and then remove some bone to get that to there. And then the good news is I can basically easily restore all that with bone grafting. But, you know, realistically, if someone says, oh, you can just get those teeth out now bone grafted, I mean, later on when you're gonna wanna place an implant, there's gonna be a lot of bone missing in the area, right? So, difficult to extract teeth need bone grafting. So very dense bone, it's obviously harder to remove something from concrete than it is to remove from something soft like drywall. I go up to the drywall, grab a set of pliers, pull the screw out of the wall. Go to the concrete with the screw in the concrete, I'm gonna have to drill it out. Well, you know, I'm gonna have to then restore some of that concrete. So long story short, the harder the tooth is to extract, the more likely the more bone will be removed during the extraction process. This results in more bone removal. Remember, you want as much bone around your future implant, so you want to bone graft and replace the bone that was lost, just like we would want to replace the concrete that I drilled away. So, I included this little topic here, so if you could follow me on this, you're really going to understand some of the deeper concepts of bone grafting. Because when somebody says, I'm just going to do bone grafting on you, and how much it's going to cost, or how invasive the procedure is, or how long the healing process is, or even if you have periodontal disease and someone says, oh yeah, I'm going to just do bone grafting on you. I mean, I've seen a lot of unethical stuff in the past too, where literally every tooth is getting bone grafted when it's not even a graftable site. So if you can understand this concept right here, you'll be able to understand whether your bone grafting is going to work, and understanding, is the money going to be worth it for you to have some sort of predictability, so that therefore you're not going to be a patient that paid for bone grafting from $1,000 to multi-thousands of dollars for a bone graft, and then the surgeon's saying, or you have issues after your implant placement. Well, what the hell happened? Well, honestly, the area wasn't really graftable in the first place, right? So if you can understand this, then you'll be able to understand it. So hopefully I can explain this really, well for you guys. Okay. So what if you lost bone from periodontal disease, trauma, or again, from one of these very difficult extractions I showed you earlier, like a root canal tooth, or a tooth that had crazy roots, or a tooth that had cavities and stuff like that, right? So how easy it is to rebuild a bone depends on how well confined the bone can be when we place the bone graft. Okay, so what in dentistry they call these 3-wall defects the most predictable grafting. Okay, so on the, let's say, the tongue side over here, and then the other side towards another tooth, and then this outer edge, which is the cheek side, you have layers of bone. Okay, so when I place bone in here, like these particles of bone, it is a well-confined pothole that basically the bone stays well-defined in, and therefore I could just put something called a membrane on top of that, and when you heal, because everything's confined in that pothole, just like if I was to go outside and pour some wet concrete into a pothole, it should heal. I mean, it should set properly, right? Because all the concrete is well confined in the walls of the pothole, and it's not flowing off somewhere, right? And if it's not leaking out, then because it's well confined, it's gonna, heal great, right? Just like when we have it in the mouth. Now, 2-wall means one less wall, obviously, than the 3-wall. And let's imagine this outer edge of bone is missing, right? So if I pour bone in here, like bone particles, and I want that to heal, well, what can happen is, every time you're chewing, what can happen is the stress or the pressure from the top can push out the bone particles through the side, the cheek side, or the tongue side, or whatever. And when that happens, then because there's going to be movement of that the bone, then, and it's sloughing out here, then you're not going to have a very ideal result unless you put a very rigid structure out here to confine that bone and through the side, and also tell that person not to distort, move, or chew anything on that side, right? So 2-wall defects can still be done, but they then become way more susceptible to making sure that no movement is going to happen on that side, and also we use a rigid structure so that the particles aren't going to escape. Okay, I actually had a really great example where this guy was doing fixing concrete, and he put there was an outer edge on the corner, like that was a chunk missing, and he put a board and sealed it on that side so that when he poured that concrete in, that wet concrete wouldn't basically flow out the side. Okay. Now, 1-wall defects is now when it's missing another wall, right? So not only is it missing the outer wall, but it's now missing the other inner wall too. And that's where it gets really unpredictable, right? So not saying it can't be done, but you can use very rigid membranes and tacking screws and stuff like that, and tell patients to really follow their post-op instructions to not put pressure on that area, just like you wouldn't want to step on wet concrete, right? Then, because it's not going to set properly. So hopefully I was able to explain this, easily for you guys. So if we pour wet concrete into the pothole, the concrete has nowhere to escape, so it's easy to fill and set and looks great afterwards. Imagine if we had 3 defined walls, as we do here. The bone could only exit out the top. We put a membrane over it, and as long as we don't chew on it, the bone will heal great. Imagine if you had only 2 walls, this wall and the inner wall. It gets harder to confine the wet concrete, and it wants to exit out the outside edge. This is why you have to be more careful to not distort the outer edge or the bone will move and the graft will fail. And then you have a one wall defect, which is even harder to contain the concrete, like I just said. So now let's talk about what types of bone we're adding, right? So there's different types of options out there to use. Autogenous is your own bone. It's typically harvested from your jaw or hip if we need a lot, right? So more invasive if we need a lot of bone, obviously, because we're harvesting from your hip or jaw, other areas, ribs. But advancements have led to it not being used because this technique is a little outdated unless you need a monster amount of bone. Again, if you've had cancer or major trauma or something like that. One of the downsides of it is that it tends to resorb more than the other types of bone grafts. However, it is a great option still for the huge bone grafts, again, the trauma, cancer, etc. Okay. Allograft is donated bone from human cadavers. Sounds scary, but it's sterile, right? As long as you're working with a good bone bank. Then you have xenograft, which is donated bone from other species such as pigs, cows, etc. So some people might not like that due to religious reasons. Then you got alloplast, which is synthetic bone, and to this day I've never used alloplast because I've heard nothing but not great stuff about it, and I've never tried it in a patient's mouth. So what does bone graft typically look like? It literally looks like this. Okay, it looks like large particles of sand. Whether it's allograft, which is from donated cadavers, or xenograft, which is like cow, pig bone, or alloplast, synthetic bone, it always typically looks like that. So different bone types have different applications. So most dentists use allograft most of the time, so sterile human cadaver bone for most bone grafting. Xenograft, bone from cows, tends to be used more often for bone grafts, cows or other species, right? So cows, pigs, tends to be used often for bone grafts in the sinus, during sinus lifts, and for bone grafting for front teeth implants. And the reason that is that it tends to resorb very slowly, and that's its main benefit. So there's so many details about this topic, but I'm going to keep it relevant to what you need to know as a patient. So a few slides ago, I talked about membranes, right? I was talking about putting like a membrane on top, or it's basically a barrier. So bone grafting also requires membranes, and membranes are barriers that separate the bone graft from your gums. So bone heals 1/10 the speed of gums. And as a result, the gums have a tendency to want to grow into the bone grafted area unless you can barrier off the gums from infiltrating into the space. Therefore, we use membranes. Okay, so because the gums heal so fast, they want to penetrate into that space where the bone is trying to heal. And then if that happens, then the bone's not going to heal ideally in the area, and you're going to end up with way less bone. So that's why when you're doing bone grafting, it's very critical that you use membranes. So membranes come in resorbable, which is dissolvable, and non-resorbable, which are non-dissolvable options. So resorbable membranes are collagen membranes, and there are some collagen membranes that are extremely short-acting, which dissolve in a few days, but do not use these for these bone grafting procedures because, for that, they're garbage, okay? So the short-acting ones, do not use them. For some reason, some dentists use these and they result in subpar results, and I've seen over the years some people use these short-acting ones, and patients will have all the membrane resorb, the bone graft will fall out, patients pay for a procedure, and they have horrible results. Collagen membranes have options that expire after a month or after several months. And also we have non-resorbable membranes, which are used for more extensive bone grafting, which is guided bone regeneration that we'll discuss later in this presentation. And non-resorbable membranes options include titanium mesh membranes, Teflon membranes, expanded Teflon membranes, dense Teflon membranes, and these are the most common non-resorbable membranes used today. And then let's talk about sutures real quick. One final point when doing bone grafting procedures, you got to use non-dissolvable stitches, sutures. The sutures should stay in for about 3 to 4 weeks, and what to look out for is make sure you get a bone graft done with a longer lasting membrane. Again, I mentioned that in the previous slide. Collaplug and Collatape, which are short-acting collagen membranes, are useless for bone grafting and dissolve as if they're like toilet paper. Also, for some reason, some people use dissolvable sutures on top of the bone graft, and that is a horrible mistake. You'll get a lot of bone spilling out of your socket with dissolvable stitches. So, a very important point for patients, you must do your part, follow the post-op instructions closely to have the best results. The best technique and the best products are worthless if you don't follow your instructions, okay? Super important point. To reiterate, bone graft is like wet concrete. I'll always use that example, okay? You do not want to push it on it or distort it during the healing period. And distorting it will cause the bone graft to fail. You do not want to move a healing broken bone. Same goes for bone grafts. So there's different types of bone grafting procedures. You got socket preservations, which is when we take the tooth out and you have the bone socket there, the hole in your jawbone. We place the bone graft in there, which is the particles. It looks like particles of sand, and then you put the membrane on top, and then you use a non-dissolvable stitch. And those are easy because those are like defined sockets, like the potholes, like I was talking about, the 3 and the 2 wall defects, right? Then you got these other type of bone grafts, which are the onlay bone grafts, where you add bone on the outer edge, right? I mentioned earlier in this video that bone's most often lost on the outer edge. So adding that bone on the outer edge, and it can be added in small amounts on the outer edge or very large amounts due to extensive bone loss, again, whether it was infection, been a long time since you've been missing the tooth, trauma, whatever, okay? So bone grafting at the time of the tooth extraction is what we call socket preservation. So if you go to a dentist, when you take a tooth out, we're gonna do bone graft, they call it socket preservation. It is the most predictable type of bone grafting, which is done at the time of the tooth extraction. It is only the most predictable if you have all 4 walls of bone present, right? Now imagine if you had 3 walls, or 2 walls or whatever, then it gets less predictable, okay? Remember, we need to 100% of the time bone graft anterior front teeth at the time of the extraction. Remember, for posterior teeth, you don't 100% of the time need to bone graft, but if you have thin bone or if your tooth will be difficult to extract, then you absolutely should bone graft. And healing from this procedure typically takes 4 months or so healing, unless it's root canal, which will take longer, okay? So onlay bone grafts, there's 2 types, small onlay bone grafts and large ones, which again we call guided bone regeneration. Small onlay bone grafts, if you have enough bone to place your ideal implant in the ideal position, but you may still need a little more bone to make sure you have the 2 millimeters of bone on the buccal edge, which is the outer edge, okay? So small onlay bone grafts typically happen at the time of the implant placement and typically takes about 4 months to heal. Sometimes in certain instances, there will be extensive bone loss from a very large gum disease infection, large root canal infection, trauma, car accident, punch to the face, again, falling on the sidewalk, or tooth that is extremely difficult to remove that will destroy a lot of bone in the area. In these cases, extensive bone grafting called guided bone regeneration will be required, but this is more invasive and more costly. The added bone must be protected from any pressure or movement from the gums, right? So again, don't step on the wet concrete. Guided bone regeneration done with a lot of bone is sometimes protected with special membranes like titanium mesh or the titanium reinforced Teflon membranes that we discussed earlier. And so this is an example of a titanium mesh membrane, again, to protect that area, because any distortion or touching or movement or chewing on that side when that bone is trying to set is going to compromise the results. Guided bone regeneration. So this procedure is used to add significantly amounts of bone horizontally. If bone was lost in a vertical dimension also, then you must also use the same procedure, guided bone regeneration. But vertical bone growth is very unpredictable. It is definitely harder for the surgeon to do. Quite frankly, I've done thousands of bone grafting procedures and find it one of the most unpredictable procedures we do. When we add significant amounts of bone, then it's like I was going to add, let's say, 100 pounds to my gut overnight. My skin would stretch and be very tense, and then would eventually start to die off. And this same problem occurs with guided bone regeneration. And if you watch some of those shows like Botched on TV, like they're talking about breast implants, like if you have too thin skin and if you place too large of an breast implant, then you can have tissue to start to die. And literally the same thing happens when we're doing bone grafting within your mouth. So if we add a significant amount of bone, then the gums will be stretched significantly and cause too much tension, and the gums will die, and therefore the bone graft will fail, okay? The gums must completely cover the bone graft during the healing process, and if it doesn't, then the bone graft will fail. The gums must not have tension or too much tightness after the gums have been sutured. Okay, so again, if I'm to give my example where I'm wearing my shirt and it fits me normally and I add 100 pounds to my gut, my shirt's not going to be able to get into my pants. I can't tuck my pants in anymore. So if I try stretching it, what's most likely going to happen is my shirt's just going to rip open. Okay, so if that happens, there's too much tension that's going to rip open, then my bone is going to be exposed, and then it's going to have infection. Okay, so the gums must not have tension or the tightness after the gums have been sutured. Too much tension always results in the gums opening up and or the bone graft failing. And as a result, a special type of incision must be made in your gums and muscles to release your gums to give it the slack to cover the newly added bulk of bone. However, this results in significant swelling and potential discomfort. Okay, so again, what if, my shirt's fitting me great right now, but I had my 100 pounds I add, now my shirt's not fitting, I'm trying to stretch, trying to tuck it into my pants, and I use my drawstrings or belt to hold it in, but then eventually what's going to happen is the shirt's just going to rip open, right? And then rip open, then like my belly is going to be exposed, I get infection, all these things, right? So going back to the example, what if I can make this incision in my muscles to basically, or my shirt, to then give it the slack to then pull over? But again, that incision will cause a lot of swelling and potential discomfort. And so I'll create another video talking about it, but you can use like steroids and stuff like that to help reduce that swelling effect if you take it heading into the surgery about 24 hours before surgery. So guided bone regeneration, it's a very technique sensitive procedure. It is advisable to see a surgical specialist or somebody well versed in the procedure to ensure a good result. Okay, there's some people in the world like Urban in Europe, Uli Grunder, certain people, Dr. Danny Boozer, some of these surgeons in the world are just insanely good. When you do these very large guided bone regeneration procedures, go see a specialist. Okay, I don't want to get attacked on this by other dentists or whatever, saying, oh, like, listen, I understand there's other dentists who may be insanely good at doing like certain types of procedures, but if you don't know who to find or who to look for or get word of mouth, then as a general rule of thumb, go see some sort of surgical specialist who has a lot of extensive results with guided bone regeneration. Some other rules. Non-dissolvable sutures must be used. Long-term collagen membranes can be used. Titanium reinforced or non-resorbable membranes are also a good option for extensive bone buildups. And 5 to 6 months, ideally, I like to give 6 to 7 months of healing. And strict adherence must be given to the post-op instructions. Bone grafting has limitations. Bone cannot just be grown at will, okay? There are biological limitations. You must work with an experienced surgeon when trying to build more extensive bone. Not all surgeons are equal. Just because they're an oral surgeon or periodontist doesn't mean that they're going to be awesome at this, okay? That's just reality of the world. Some are better at placing implants while others are amazing at building bone. Others are amazing at doing gum grafting. Others are amazing at doing all-on-fours, implant dentures, all that stuff. Everybody has their own little niche. So just, you need to do your research, okay? Also, it's not only on the surgeon, it's on you. You must follow the post-op instructions carefully. Bone graft waiting to heal is like waiting for concrete to set. You do not want to put pressure on the area, chew on the area, etc., and the area should not be contacted at all. So hopefully that information was very helpful. In my next video, we're going to be talking about if you want to get dental implants with them, what are the options? Can they be used to replace one tooth, multiple teeth, all your teeth? And what are the associated costs with all those options? What are the timing options, all that stuff? So that's going to be the topic of the next video. So please stay tuned. And again, check out the info below and make sure you watch our other videos. Thank you.